Hello everyone, this is Physician Supervised, Preventive Medicine TV. Today's topic will be the 3 signs of the cerebral hemorrhage you must not overlook. By watching this video, you can learn whether you have the possibility of cerebral hemorrhage and when to go to hospital or call an ambulance. We'd like you to remember at least the 3 types of headaches which will be explained in this video. If you underestimate those symptoms, you might even lose your life. First, there are many people suffering from headache on a daily basis. It is said that about 10% of adults has a migraine as a chronic condition. Some of them can't even work properly because of the migraine. Of course, these kinds of chronic headaches are a big problem, but we cannot miss a few signs that may cause more serious problems in your life. Simply put, it is the headaches caused by the cerebral hemorrhage, such as the subarachnoid hemorrhage as a well-known example. If you have a possibility of having a cerebral hemorrhage, you must go to see a doctor and take a CT scan to find a bleeding in your brain. Since a cerebral hemorrhage might need a surgery, in the worst case, it will cause a loss of consciousness due to the high blood pressure. But you would say, why would I bother going to hospital for just a headache? That's why we are going to introduce you to the topic of the day. If you have these kinds of headaches, you must go to hospital or call an ambulance. The headaches caused by the cerebral hemorrhage will come to you in different forms of pains. So we're going to discuss the 3 major patterns that doctors would think it might be severe. Let's take a CT scan. Even if it's a dangerous headache, the patient people would wait and see the pain and eventually find out it is a subarachnoid hemorrhage when it's too late. Surprisingly, the headache due to a cerebral hemorrhage does not cause much pain, so that many patients wait it out. A few days later, they decide to go to see a doctor because the pain doesn't go away, and finally diagnosed with a subarachnoid hemorrhage. The signs of the dangerous headaches in this video are very easy to identify and remember, so please bring it with you today, it's worth knowing. Well then, let's get started. By the way, this channel provides evidence-based medical and health information from a doctor's perspective, so I think it would be helpful to subscribe to the channel. The first pattern of the dangerous headache is the most painful headache in your life. You must go to see a doctor if you have a pain that you have never experienced before. It would be as if you are hit by a 3-ton hammer in the head. The worst case is when this type of headache happens to someone with a migraine. These people are tolerant to headaches so that they are more likely to think, I've never been in such pain, but maybe it is just a migraine. I should take a rest and it will go away. Whether you have a migraine or not, when you are experiencing the worst headache, please have an examination done. A pain you've never had means something unusual is happening in your head. Please do not underestimate it. The second pattern of the dangerous headache is the sudden headaches. We need to elaborate what this sudden means. For example, it is the case that you can tell that headache happened at what time, or it started right after the TV commercial came on. You can think of it as the case that the pain level shoots up from 0 to 100. The major cause of cerebral hemorrhage is due to a ruptured aneurysm, a rupture of a bump in the artery of your brain. This type of headache happens at the same time as the bump ruptures. So doctors usually stand ready when a patient with a sudden headache visits. In case a sharp stabbing pain comes, please be especially careful. The last pattern of the dangerous headache is the first headache for someone who doesn't suffer from daily headaches. In this case, you should be very careful even if the pain is not the most painful or the sudden headache. Of course, it's not 100%, but to tell you the truth, for those who usually have a headache, it's probably the same headache. However, when it comes to those who don't have a headache, something unusual is happening to your head. Especially for the elderly people, it is even said that the possibility of developing a sudden migraine is 0.52%. That is to say, the first headache in elderly is most likely to be very dangerous. Please keep in mind that we need to be aware of any events happening for the first time. Finally, let's go over what we have discussed today. The first headache, the worst headache, and the sudden headaches are very dangerous headaches. There is a possibility of the cerebral hemorrhage. Please do not underestimate it just because you can put up with it. Maybe you can stand the pain at the time, but you may regret it for the outcome later. So please go to see a doctor. Thank you for watching this video. If you like this video, don't forget to hit the like button. Also, we'll be glad if you could comment on this video. We'll be waiting for your next consultation. Thank you.